My name is Christina Kramer. I'm one of 3 board-certified obstetricians and gynecologists here at CRMC, part of the women's healthcare team. I've been practicing at Cuyuna for the past 4 years. I am a native Minnesotan and went out east to do my training and then came back home to start practice.
Perfect. Okay. Remember not to look at Dan.
I know, I saw that. I was like, oh.
Okay, so I don't even think I can pronounce this. Endometrial ablation. I have no idea what it is, but let's talk about it.
So I'm going to talk about endometrial ablation today. That is a procedure commonly done in the gynecology world to treat heavy abnormal uterine bleeding. An endometrial ablation is a procedure done in the operating room, most commonly. Some offices do it in their office, but we don't have the setup here, in order to treat heavy menses. Now, an endometrial ablation is really designed for women who are premenopausal to treat their heavy periods. If a woman was having issues after menopause, that would be a different set of issues that we would be worried about and a different treatment plan. So an endometrial ablation is designed as an outpatient procedure, and a lot of procedures are done as outpatient, but this one you're able to come in, have it done, and go home the same day. There are no incisions, and so there's really not a lot of downtime for the patient. Commonly, I'm having patients have their surgery on a Friday, and they're more than ready to go back to work on a Monday. There is a little bit of a recovery time as far as some cramping and then some light bleeding that can occur and last up to 1 or 2 weeks, and then more of a watery discharge that can last for about a month or so. During that time, patients are instructed to abide by pelvic rest, so no sexual intercourse, no tampons, and no swimming. But besides that, there's really not a lot of restrictions, and so there's not a lot of downtime for the patient. Though the expectation with the procedure is that it should normalize periods, not necessarily make them go away. So an important part of the conversation between a provider and a patient is patient expectations. Some women are more than happy to have their menses go down from 10 days to more like 3 or 4, but I always tell my patients if the expectation is to never see a drop of blood again, well, that may not be the best procedure. It is not a form of birth control, and so there is a component of sterilization that needs to be accomplished because pregnancy after an ablation can be very dangerous. It is best designed for women who are completed with childbearing. So for that, I would not recommend it for a younger patient having heavy periods or a woman who wanted to have babies in the future. Another thing about the ablation is there's different techniques and procedures and ways to do that, but some of it is limited based on the equipment and availability and what's currently on the market. So the most common types of ablation that you'll see is something called a radiofrequency ablation, which is similar to a microwave technology, or resectoscopic ablation, where we actually kind of shave off the lining of the uterus. Again, both of those are under the umbrella of endometrial ablation, an outpatient procedure, no incisions. If that's something that a woman is struggling with heavy periods, we pursue a typical workup first, just to make sure we're not missing other medical conditions that would make a woman not a great candidate for an ablation. So some of those conditions would be a precancer of the uterus, or a patient who would be at high risk of developing cancer of the uterus in the future, certain genetic conditions, if there's certain structural lesions on the uterus. But this is something that the provider would talk to you about during the course of that evaluation and the treatment plan. You can just come and see us in the office. Patients can be self-referred. They don't need to see their primary care provider first.